Hi there, Dr. John Quinn here from Quinn Clinics in Bristol. So welcome to my laser room. This is where most of my laser devices hang out. And this is my best friend. This is my Luminous M22 IPL and laser platform. This is a machine that I use most commonly in the clinic, and I use this nearly every day. Very versatile, treats a number of different indications. So stuff that we see very commonly would include sun damage, rosacea, thread veins, acne scarring, and other benign vascular lesions that we can see on the body, like Camel de Morgan spots and thread veins on the legs. So what we're going to do today is actually a test patch, because whenever we see someone for the first time, we always perform a test patch with any non-ablative laser procedure. So that means a laser where we don't want to injure the skin. Some lasers work by injuring the skin. That's more like a laser peel. But with something like this, the laser, or in this case the light-based energy, is preferentially absorbed by targets in the skin which are called chromophores. So the main targets that we're aiming for are brown, so pigmentation. It's also why IPL works for hair removal, although we don't tend to use it for that in this clinic. And the other main chromophores would be hemoglobin, which is the blood within the vessels. And the last chromophore is typically water. So with IPL, we're targeting both brown and red, but we get a secondary skin improving effect because IPL heats the skin, and that heat's really, really important. So we do a test patch because we want to make sure that the skin reacts in a normal fashion, and because if the energy is too high for the particular patient we treat, it could leave them with a blister, which could even leave them with a scar. So in 11 years of treating patients with IPL and laser, we've never had a scar. We've had the odd blister here and there, and they tend to heal okay, but it's the reason why we have to do a test patch. So that's what you're going to see today. So we're going to do our test patch now. I use the cold air just because it helps a little bit with the pain. I'm going to count you down. Here we go. 3, 2, 1. 3, 2, 1. 3, 2, 1. How's that feeling?
Fine.
Yeah, what does it feel like?
Obviously got cold air blowing.
Yeah.
And just, slight heat.
It's like a flick.
Yeah.
Exactly. So IPL feels like the flick of an elastic band, and straight after the treatment, what we expect to see is maybe a little bit of redness on the surface of the skin, some darkening of pigmentation. And if you can you zoom in on the surface of the skin for me? So if you can see right here, you can see that little bit of pigment has actually gone a teeny bit darker, but the rest of the skin looks entirely normal. So that, as a test patch, that's totally fine.